always great to see so many leaders in one room. We'll have a great discussion today about the impacts of Medicaid on this community. I'm Phoenix Mayor Kate Gallego, and I'm really pleased to be with all of you here today and to welcome our U.S. Senator Mark Kelly, as well as many distinguished Arizona leaders. We're thrilled to be at Valleywise and thankful to Valleywise for hosting us. The changes in federal legislation impact us deeply at the City of Phoenix, but more importantly, they impact everyone in Arizona. And we'll have an important discussion today about those impacts. We have an amazing panel with us, including Beth Kohler, the CEO of the Arizona Association of Health Plans, Brittany Kaufman, CEO of Arizona Health Systems Alliance of Arizona, Helena Whitney, Senior Vice President of Policy and Advocacy, Arizona Hospital and Healthcare Association, Lisa Neary, Chief Program Officer, Arizona Alliance for Community Health Centers, Candy Espino, President and CEO, Arizona Council of Human Service Providers, Ray Ochoa, Assistant Chief, Phoenix Fire Department, Scott Hall, who is with our Phoenix Office of Homeless Solutions. And again, it's great to have a champion for Phoenix and for Arizona, for Senator Mark Kelly. Thank you for your advocacy on behalf, and I'll turn it over to you.
Well, thank you, Mayor. Thank you for bringing us together. Thank you, everybody, for being here. And to everybody who's joining for this important conversation about the future of healthcare in our state and what the administration's budget bill means for the future of healthcare here. We're here today because of the Medicaid cuts. The administration's policies are going to touch every part of our healthcare system. They're going to affect patients, providers, hospitals, and communities. Some of these changes are going to come pretty soon, but others are going to take some time. It'll take a few years for those changes to be implemented, but over time we're going to see a major shift in how healthcare is delivered for Arizonans and who has access to any healthcare at all. We've seen the estimates. Hundreds of thousands of Arizonans could lose Medicaid coverage over the next decade. We could lose about $2 billion a year in federal Medicaid once these cuts take full effect. And premiums for many Arizonans are going to go up by upwards of about 26%. And that's for folks who get their health care off of the Affordable Care Act exchange. So in many cases, it will no longer be affordable. And this is going to mean that many people get priced out of health insurance. What that means is that a lot of working parents will be unable to take their kids to a doctor. And sick people are going to have to wait longer to get into an emergency room. And it also means that for seniors, after a long life, might see challenges getting into assisted living and nursing facilities. This isn't making our state any better. Now, I've held town halls across the state where I've talked to people who feel they're going to be impacted by this, and I heard some very compelling stories, many stories. Like a mom, Kiana Brown, who has adopted kids out of foster care. Those kids are on Medicaid. One has significant health care needs. She fears that she could lose that Medicaid coverage, and she told me, it feels like they're burning down my house, and my kids are still inside. Just because this bill is passed, it doesn't mean we're going to stop fighting to make this right. The mayor and I are continuing to be in this fight, and I'm committed, and I know she is, to work with other local leaders and healthcare partners to make sure that we understand what these changes mean and what the impact is going to be, and that we prepare for them, and that we protect access to healthcare for the people who need it the most. So I'm looking forward to this discussion, and I'm looking forward to the opportunities that this might present to working together to improve healthcare in the state of Arizona and to mitigate the worst effects of this legislation. Thank you.
Thank you, and now we will welcome our host, Steve Purvis, the President and CEO of Valleywise Health.
Do I need to use a mic? Yes. Or can you, okay. Or I can just do it. So I'm gonna stand over here so I don't have to have my back, to anyone. I simply want to welcome everybody here to Valleywise Health today. Senator Kelly, Mayor Gallego, we're delighted that you're here, and we so appreciate your strong advocacy on this important issue for everyone. We have a wonderful, amazing group of panelists here today, and great audience here today. So want to tell you a little bit about Valleywise Health. As you know, we're a public safety net system of care and a public teaching hospital. About 50% of our revenue comes from Medicaid or supplemental funding related to Medicaid. We're part of the safety net infrastructure of Maricopa County, along with all of the other hospitals, all of the other clinics who serve Medicaid patients. So obviously this is an issue that is extremely important for all Arizonans. It is something that will impact quality of life for everyone, not just in healthcare. So if you really take a look at the impact of federal Medicaid cuts, there is a ripple effect across communities across Arizona. The Arizona Chamber Foundation has a report out there that documents and analyzes the impact on just from an economic standpoint, jobs in Arizona. For every $1 billion of cuts in federal Medicaid funding, 36,000 jobs across multiple industries in the state of Arizona. And that's not talking about the impact on care to vulnerable patients in our communities. So we all have emergency rooms. Every single hospital system here has emergency rooms. The need is going to still be there. The only difference is patients are going to come to us. They're going to be sicker. It's going to cost more. They're coming to us, but yet there will be no source of funding. That is not a good thing. It will put pressure on the safety net that we have, across Arizona. The rural facilities are going to be especially hard hit, and we need to protect our rural communities. So I could go on and on about this, but we are delighted to be able to host this forum today. We are trying to keep up with the demand, especially in care of vulnerable patients. Sorry about the construction on our campus. It kind of looks like a bomb went off over there, but that's all part of a longer-term master facilities plan to be more responsive to folks who need our care. So thank you for being here. I'm going to turn it back over to Mayor Gallego with my thanks and appreciation for both you and Senator Kelly. I will tell you, Senator Kelly has always been available to listen to issues. Not only does he listen, but he takes action. And so I appreciate both of you organizing this event today. So thanks so much.
Thank you, Steve. And very important, that construction is happening because voters invested. Voters overwhelmingly approved bonding to help this health system grow and strengthen, because our voters do care deeply about that topic. Now we're going to turn to Beth with the Arizona Association of Health Plans to give us an overview about these cuts.
Great, thank you. And thank you, Mayor Gallego, for convening this, and Senator Kelly for being here. Both of you have been such important voices in this discussion and helping Arizonans and Phoenix residents understand the impact of what's to come. So I wanted to extend my thanks and my gratitude to both of you. So I have a lot to cover here, so please forgive me in advance. I'm probably going to pick up the speed of how I'm talking because there's a lot of ground. I also want to say for the audience that we are not covering nearly everything that is in this bill. We're hitting the highlights and trying to paint a big picture about what the impact of these federal Medicaid changes might be, but it is certainly not an exhaustive list. So level setting to begin with, just a reminder for people what actually is Medicaid. And Medicaid is our state's health insurance program for people who, by virtue of their income, either do not have access to or are unable to afford private health insurance. It is distinct and different from Medicare, which is the federally operated program for older adults. But I think it's important to know that you can be enrolled in both Medicaid and Medicare, and approximately 150,000 Arizonans are enrolled in both programs. So Medicaid serves the spectrum from newborns to older adults and in between. Nationally covers 1 in 5 Americans, including pregnant women, children, seniors, and people with disabilities, but each state administers its own program. So here in Arizona, our Medicaid program is known as Access, the Arizona Healthcare Cost Containment System. So if you are enrolled in Access, you are on Medicaid. Not everybody knows that, so I like to start out by pointing that out. And Arizona, in true typical fashion, was the last state to join the Medicaid program. We did not start until the early 80s, and Access now pays for a wide array of services. So not only does it pay for hospital care, like the care provided by Valleywise Health, but also primary care, preventive care, hospital stays, long-term care, mental health, prescription drugs, the whole spectrum of healthcare services available to members. And Access contracts with private health insurance companies to administer the benefit for most populations. And those people are my members of my association. So the health plans in our name are those contracted private sector health plans who administer the Access benefit for the almost 1.9 million Arizonans enrolled in the program. Really quick at a glance, as I mentioned, 1.9 Arizonans, 21 plus. In fact, new budget numbers just came out from the legislature. They're tracking $23 billion budget for next year. Access covers 50% of Arizona's births, has over 100,000 healthcare providers, the same healthcare providers that people with other forms of insurance utilize, and pays for more than 60% of the nursing facility days here in the state of Arizona. And I note all this so you have a sense of the breadth of the reach of this program and how it impacts all Phoenix residents and all Arizonans, even if you're not enrolled. So who is eligible for Access? You heard a lot of dialogue at the federal level of people who should be on the program and people who shouldn't be on the program, but Arizona voters have really already answered that question. And they expanded about 25 years ago Access enrollment to all Arizona citizens with incomes up to a certain threshold. And right now that threshold with the Affordable Care Act expansion is about $21,000 per year for an individual and close to $43,000 for a family of 4. So if your income is below those thresholds and you meet all the other eligibility requirements, you can qualify for Access. And most of those people are voter protected. Our voters decided who the program should serve and who deserves to be on the program. And so that coverage for those individuals, most of the individuals we're talking about, is voter protected. Really quick overview, just so you see again the breadth of the reach of the different providers that the program pays for. This shows you where Access spends its money, but it's pretty well distributed between hospitals, behavioral health, mental health, and substance use disorder treatment. Pharmacy services, physicians, it really pays for that wide array of services across the healthcare spectrum. So let's do a brief overview of PL 11921, you may hear this called the One Big Beautiful Bill Act. You may hear it called HR 1. I'm trying to be technical in my reference to the legislation, but it was signed on July 4th. It has major impacts to the operation of state Medicaid programs across the country and here in Arizona. And among other provisions, which include the extension of tax cuts and other changes to federal programs, the bill makes significant restructuring to Medicaid programs and will result in about $800 billion in lower Medicaid spending over the next 10 years than would have occurred without the bill. So that's approaching $1 trillion in lower spending and impacts. I mentioned other provisions. As a whole, the bill will increase the deficit actually by $3.4 trillion, but it does make reductions here in the Medicaid program. We'll talk a little bit about those. So the Congressional Budget Office estimates that these changes will result in about 10 million nationally fewer people enrolled in Medicaid and the health insurance marketplace as a result of the changes in the bill. And then there are other policy changes that were not included in the bill to extend subsidies for marketplace coverage that Senator Kelly mentioned. That will result in another 5 million individuals, fewer individuals with health insurance is estimated over the next 10 years. And so again, in total, about 15 million fewer people estimated to have health insurance by 2034 as a result of these and related changes. So that will be a big impact, and we want to talk a little bit about why that will impact everybody, not just those who directly might not have access to health insurance coverage anymore. What does it mean specifically here? All of the numbers I'm giving you at this point are a best guess from the budget hawks and others who are doing these estimates, but that best guess preliminarily is that between 200,000 and 350,000 more Arizonans will not have health insurance as a result of the changes. And Senator Kelly mentioned there's a $2 to $3 billion estimated reduction in federal Medicaid spending in Arizona, and that number will likely increase sort of over the time period. That number's an annual figure, by the way. So what are the main changes that the bill makes to the Medicaid program? I'm lumping a bunch of different provisions together, but as a whole, it is making it harder for people to get and retain their Medicaid coverage, making them jump through more hoops, fill out more paperwork, and provide more documentation, particularly for certain populations, adults without dependent children, but some of the provisions will likely impact everybody. It also limits the sources the state can use to pay for the Medicaid program, so it will reduce access to other monies and put more pressure on the state budget as a result, and it reduces the amount that Medicaid can pay out to providers, and we'll talk a little bit in more detail about each of those. I don't want to get too in the weeds, but again, as I mentioned, a variety of provisions making it harder to get and retain Medicaid coverage. The one you may have heard the most about is establishing the requirement that certain individuals enrolled in Medicaid prove to the state that they are either working or in educational programs, or that they qualify for an exemption for those requirements. And I'll talk about who that applies to and who's exempt in a second. But people will have to submit to the state documentation that they are working, or they will not be eligible to enroll in the program. And again, this only will apply to certain populations. It will not apply, for example, to pregnant women, to children, to people with a documented disability. We'll talk about the other exemptions, but other adults here in Arizona, you may hear the term, the Proposition 204 childless adults, or the Affordable Care Act expansion population. Those are the key populations to which these provisions apply. It also requires the state to check Medicaid eligibility every 6 months for those populations instead of once a year. So people will be notified they have to, again, submit additional documentation if the state doesn't have continued proof that they're eligible. And we know, just from experience across the country, that the more paperwork we make people provide to the state, the harder it is for them to understand what those expectations are. We see fewer people complying and more people falling off the program. Now, of course, people still get sick. People still need health care, regardless of whether they've submitted the paperwork to the state or not. And so we do expect that when people get sick, they're going to present to our provider friends. They're going to come to a hospital emergency room. They're going to call 911. And those providers will need to have an infrastructure to help people understand how to get on the program, both for the benefit of the individual, but also so their healthcare bills get paid when they're providing that emergency level care to individuals. So you're going to see increased cycling on and off the program by people particularly with high healthcare needs. So I talked a little bit about who the work requirement is intended to apply to, those childless adults and expansion populations. You may hear nationally these populations being referred to as able-bodied. But there are a lot of people with diverse healthcare needs in those groups that are being framed as able-bodied again. So you'll hear me talk about childless adults or the expansion population, because within that you have people who are experiencing homelessness. You have people who have severe mental illness. You have people who need cancer treatment. You have people who have significant chronic illnesses who need constant medical care. So there is a lot of different healthcare needs within the populations that this will apply to, but the bill does stipulate some clear mandatory exemptions from the work requirements. And those include, they're listed here, but those include a lot of people with those high healthcare needs. But those people will need to, again, prove to the state that they fall into one of these exemption categories. So the state is going to have to build a significant infrastructure where they can electronically check, does this apply to people or not? And then if they can't find an electronic verification of whether a person is exempt, they need to give people an opportunity to tell them. So someone can show up or go online and submit paperwork that demonstrates they're exempt and these additional requirements don't apply to them. So this infrastructure that the state will have to build, we know from experience in other states, is going to be very costly. The agency Access is working on estimates, but I'm going to tell you that it's going to be tens of millions of dollars, if not more, just based on what we've seen in other states that have tried to do this. And nobody's tried to do this for very long because it's costly and very, very burdensome administratively. And so also I think what you will see from this is if people are unable to demonstrate that they are exempt, for example, as I mentioned, at some point they're going to get sick enough that they need health care. They will call 911, they will go to the emergency department, and then they'll try to find a pathway to get back on the program. But at that point, those individuals will have more significant health care needs, more expensive health care needs, and so any savings will likely not be long-term with that cycling on and off the program that we expect to see. So the next big provision that I want to quickly go over is, again, just a limit on how the state pays for its Medicaid program. And right now, one of the ways that states across the country fund their Medicaid program, in addition to regular state general fund monies, is the use of what's called a provider tax. And so providers pay into the state uses that money as a legal source of state financing, and I stress legal because you hear a lot of rhetoric around these taxes, but 49 states use this mechanism. Those dollars are matched with federal dollars, and then they're paid out back into the healthcare system. So Arizona has 2 provider taxes, but the provisions in the bill will limit the use of these. So right now, there is a limit up to 6% of a provider's net patient revenues. That's going to ramp down over time to 3.5%. And I don't expect everybody to remember all the details of those numbers, but you can do the quick math to know that it will be cut almost in half, the access to that funding. And that funding right now is used to pay for coverage for about, I say 500,000 here, it's about 450,000 now with current enrollment trends, Arizona residents. So it pays for the full array of healthcare coverage for 450,000 residents. And then it provides extra supplemental payments to providers to help them get their Medicaid reimbursement closer to what it actually costs them to deliver care to Medicaid members. So you'll see additional pressure on those provider payments, as well as additional pressure on the state budget as the state has to figure out whether it can find funds to make up that money or not, and what programmatic changes it will need to make if that money is no longer available. Packaged with this is also limits on how much providers can be paid. So providers can receive extra Medicaid payments right now that approach how much commercial insurance companies pay for patient care. So you probably often hear that the government doesn't pay enough, Medicare doesn't pay enough, Medicaid doesn't pay enough. These extra payments get providers additional revenue and help them support their costs. So the bill constructs some limits on how much providers can be paid through these mechanisms, and it will limit it up to that Medicare rate, which will be a significant hit to, particularly in this state, our hospitals. Cumulatively, it is estimated right now that the hospitals will receive probably about $8 billion over 5 years less than they would receive without these limits. So that's pretty significant and will impact all of the providers who are receiving these funds. So I want to take a moment to just pause here and say, we know what happens when healthcare coverage is reduced and provider payments are reduced. We know what happens because during the Great Recession, 15 years or so ago, we did this in Arizona. We have this experience, we have the data, we have it right here. So we know that when people don't have access to health insurance coverage, as I mentioned, the theme you'll hear, keep coming back to, they still get sick. They still need health care. So they still go to the hospitals, and the hospitals are required to provide emergency level care to people who need it. So you can see this graph shows you the red line is that childless adult population covered by access. You can see it plummet during the Great Recession when the state had to make policy changes to limit it. And you can see the completely inverse relationship to hospital uncompensated care. So those of us who were working in the system at the time watched providers struggle financially through these recessionary times. We saw their uncompensated care go up significantly. We also saw, and this is a part again where we want to tie back why this impacts everybody, they shifted costs to people who were paying for their health insurance on their own. So they said, we need to keep our doors open, so we need anybody who can pay more to do so. So we saw premiums for private insurance go up. We saw that cost shift is why the business community today is such a big supporter of the state's Medicaid program, Access here in Arizona, because of those financial dynamics that impacted all Arizonans when the state previously made Medicaid cuts. And we're one of the few states that has this data to support why we know the impact that some of these changes are going to have. So I'll close with why. Why do I care? Why do my members care? And why should all Arizonans care, and the people around the table who are so passionate about this issue? Number one, obviously, we care about the people who live in this city and in this state. Tens of thousands of Phoenix residents could lose their health insurance coverage. I hope I've demonstrated and articulated why major reductions to the Access program impacts the entire healthcare sector that all Arizonans and all Phoenix residents use. If providers are unable to continue to provide the same level of service, or if they have to close locations, we are all impacted. All Phoenix residents and all Arizonans are impacted by those closures. We don't have just Medicaid-only providers in this state. And then also there's the economic impact. Hospitals and healthcare providers are significant economic drivers in this city and in our state. And as they have to make hard decisions about their own finances and they have to cut jobs and make other changes, that does impact our state's broader economic competitiveness. And so the group here up at this table, some of us worked with the Arizona Chamber Foundation, and there is a report out here, and if you can scan some of these QR codes to access it, that really demonstrates the tens of thousands, if not hundreds of thousands of jobs that could be impacted in this state when these reductions ultimately are fully phased in. You're looking at, for example, if there's a 10% reduction in healthcare spending across the board, that equates to close to 100,000 jobs here in the state of Arizona. So big, big numbers, big economic impact. And then I did want to close, thank you for the time to run through this. Again, apologize for the speed, but I did want to close with what is it important for Phoenix and Arizona residents to know now. And so if you are on Access, the most important thing is to know nothing right now is changing. You should still continue to apply for the benefits you might be eligible for. You should continue to respond to the state. If you get a notice that says, please send us this information so we can confirm your eligibility, all of those processes are operating as normal, and residents and people enrolled in the program should continue to apply for and try to retain their benefits. Ultimately, sometime next year or over the next few years, as these provisions are implemented, you may get requests for different information. Some of this may not apply to you. You won't know until you get that, but just keep an eye out for the communication from the state about what you need to do, and hopefully all of us can talk about how we're going to work as a community together to provide supports to Arizona and Phoenix residents to help them understand the changes and what they need to do to retain their health insurance. So again, thank you so much for the opportunity to give that overview. I really appreciate it.
Wonderful. Thank you, Beth, for that very important information. We are now going to hear from our panelists, starting with Brittany.
Hi, good morning. Can you hear me? Brittany Kaufman, I'm CEO of the Health System Alliance of Arizona. We represent some of the major hospital and health systems in the state. Here in the Phoenix region, we are Banner Health, Dignity Health, Honor Health, and Abrazo. So we are hospitals, but we're also health systems that try to provide care to patients where they need it most. So we have primary care, urgent care, rehab, cancer centers, and more. So I have with me Helena Whitney and my peer association, the Arizona Hospital and Healthcare Association. So we decided to kind of divide and tackle some of the issues that will be impacting our members. But two areas that I wanted to hit on, because I know, Mayor Gallego, you have been a huge champion of them, and that is our healthcare workforce development and the biosciences. You have led tremendous efforts on Phoenix's bioscience growth strategy, and there is a direct connection between Medicaid and these cuts with research and workforce. Unfortunately, these Medicaid cuts, as Beth accurately outlined, will be massive in the billions of dollars. And when you remove that much money out of the system, difficult decisions will have to be made, and because of those financial strains. So when you look at things like medical education, residency programs, and clinical research, they will be impacted. So when we talk about the physician pipeline, we all know that Arizona, like other states across the nation, is experiencing a severe workforce shortage in their physician pipeline and a healthcare workforce in general, but this is directly going to impact our ability to grow talent and to keep talent here in Phoenix and in the state. You're looking at cost-cutting measures. You're going to have to look at the costs associated with those clinical training and those residency programs. And we're struggling as it is right now to meet the needs of the state and the city as it is today, let alone how are we going to meet the needs of a growing and an aging and sadly a population that is getting sicker. And imagine if they also don't have health insurance, will only become more sick. The biosciences too, it's going to have a direct hit. Hospitals and our academic partners are big drivers of that innovation and that research, and they're going to have to look at what they can financially sustain to continue in that area. So those ripple effects, as Mr. Purvis, as you all have mentioned, are really real. It's, yes, in delivery of healthcare first and foremost, but also in research, innovation, and growing our workforce for the future.
Great. Thanks, Brittany, and thank you, Mayor Gallego and Senator Kelly. We just always appreciate the opportunity to come and talk about how important Medicaid is to Arizona. You know, Brittany covered a little bit of some really critical components. Workforce is something in healthcare that we struggle with today, and we have been for a long time. When you think about the intersection of the workforce and then actually delivering care, and what happens when you start seeing more and more individuals lose their coverage and show up in emergency departments to get their coverage, I can't overstate how people need to understand that it's not only that individual who's being impacted, it's every other person who's also in the emergency department who has their own private health insurance. You know, if you're waiting 5 hours today in the ED to get seen, you can double and triple that, because the more and more people that come into an emergency department, the longer it's going to be until anyone can get care. And I also think it's really important that here in the city of Phoenix, for all of us who live here, that we understand how the impact of these cuts in rural parts of the state are going to impact us here in the city. Right now, our rural hospitals are having to, do the best that they can to take care of people in their communities. But as they start to lose revenue, the only other option is going to be is to send more people into the city of Phoenix to get care, because all the major health systems are here. And that's going to, again, increase the burden of access to care for every single person sitting in this room and everybody that you love and care about. These cuts are going to have very dramatic impacts for all of us.
Lisa.
Thank you. Good morning, and thank you again to Mayor Gallego and Senator Kelly for this opportunity. I'm Lisa Nietti, the Chief Programs Officer for the Arizona Alliance for Community Health Centers, the primary care association for the state of Arizona. Our 24 health centers across the state provide care to 1 in 9 Arizonans. So more than 870,000 people receive care each year at our community health centers, where they get high quality, complete, comprehensive, and affordable health care services, regardless of their insurance status or their ability to pay. In Phoenix alone, we have 10 health centers operating more than 90 points of care across the city. These sites do far more than treat illnesses. Every location offers enrollment assistance as part of a whole person care, because health depends on more than just a doctor's visit. Health center eligibility teams provide assistance with HIA Plus and eligibility for programs like Medicaid, Access, and SNAP, and connect patients to housing resources, food, specialty services, transportation, cash assistance, and other community services. In 2024, Phoenix Community Health Centers collectively saw 421,486 patients, half of which were Medicaid patients. So through our work with Cover Arizona Coalition, along with Vitalist and Children's Action Alliance, we share information and resources in communities and direct people to the Connector, a tool that can help people make both virtual and in-person appointments with trained enrollment help. We bring this information into communities through schools and health fairs and other community events. As the Alliance, we also administer 2 federally funded enrollment programs with enrollment assisters in our health centers and other community partners that are embedded in their communities, where people can get help staying enrolled and getting newly enrolled into Medicaid, into Marketplace, and into health and kids care. H.R. 1, the bill that was passed in July, puts all of this at risk. Changes to Medicaid eligibility could cause thousands of Phoenicians to lose coverage. An increase in uninsured patients, as been mentioned earlier, would strain health centers financially as well, and could force some of them to reduce services or even close. If that happens, as Helena and others mentioned, even those with non-Medicaid insurance will suffer, whether it's in emergency departments or length of time in getting an appointment and being seen. We know that people still get sick whether they're insured or not, and community health center patients will still present at community health centers, and those health centers will continue to provide care. But we also know anecdotally that a 1% decrease in Medicaid coverage for patients and a 1% increase in uncompensated care creates a $1 million shortfall for health centers every year. So for us, protecting coverage means protecting health, stability, and the future of our communities. Thank you.
Thank you, Lisa. Candy?
Sure. Hi, everyone. Candy Espino with the Arizona Council. Just for reference, we provide advocacy and support to about 130 behavioral health and substance use disorder providers across the state. And collectively, they serve about over 1 million Arizonans each year. They operate over 900 facilities, and they employ about 30,000 team members collectively. And so I think that's, just important to understand, because behavioral health is an important piece of the healthcare infrastructure in Arizona. And we are very concerned about this bill. And we are, we do anticipate cuts to community-based mental health services, which these services really help prevent costly consequences such as hospitalizations, homelessness, and incarcerations. And while not all mental health instances result in those outcomes, untreated mental health issues mixed with substance use disorders can be very costly for us and definitely increase the risk. So this is concerning because the cost of community-based mental health services is far less than those other, potential outcomes. And we're very concerned about the impact that this bill will have on our ability to continue to deliver those community-based mental health services. Additionally, without, adequate crisis and inpatient and recovery resources, we really risk increasing emergency department boarding and just really worsen patient outcomes overall. And that it puts an additional strain on hospitals, which we can't afford to see right now, especially when we have resources that can meet the needs of these individuals within our communities. I also want to say, same as everybody else has mentioned, our workforce is really strained right now. And the loss of folks in our system of care is only going to continue to grow with the changes in this bill. And when we think about the increases that we're seeing in substance use, the ultimate cost is loss of lives. And that is very concerning for us if we don't have adequate services. And I will also touch on rural areas as a huge component. While we deliver services to the critical mass here in Phoenix, we definitely have concerns about the impacts on the rural communities for this. And I will just say that, a strong mental health system, it doesn't just save money, but it saves lives. And we need to consider that as we look at the impacts of this bill as it rolls out. So, thank you for having us here today.
Thank you, and thanks, and I'll be brief because you heard a lot from me earlier, but I wanted to articulate from a health plan perspective, that Access Health Plans have been entrusted by the state to ensure care is available and that members can access that care, people who are enrolled in Access. So all of the impacts that have been articulated so far make it harder for the health plans to do that job. And the one thing that a health plan is looking for members is the ability to keep their health stable. And that's cycling on and off, and having worsening provider access makes that job harder for the health plan. So they are concerned about making sure that our provider networks are strong and solid, and that members continue to have access to the care that they need.
Chief.
Good morning. Good morning, everyone. Good morning, Mayor Senator Kelly. Thank you for inviting us to be a part of this discussion. From a fire department or a fire-based EMS provider that provides emergency transportation services, I really wanted to highlight 3 areas of potential impact and adverse impacts that this bill would have. First, as emergency transportation providers, we do transport the sick and injured under DHS regulations, and currently under that, the payer model, we would see shift from insured to uninsured, right? So approximately anywhere between 35 to 40% is Medicare and Medicaid. Each, so about 80% of that ambulance recovery is Medicare and Medicaid. So as you see that payer model shift to uninsured, will be the ability to collect from uninsured patients is limited and will likely reduce in the overall cost recovery and ambulance revenue and billing. So definitely a challenge there that we forecast. The other impacts really is specific to the 911 system, our emergency response system. Beth, as you stated, the inability with the uninsured to get preventative health care, to get follow-ups, to see specialists, can impact the 911 system because of the reliance, right? They don't have that availability to get in the system, so they may have to use the 911 system to get general health care that could potentially be provided more appropriately at a primary care physician, an urgent care, or a specialist. So we can expect to see increased activities and call volumes there, and seeing sicker patients, right, which is why we are there. And then the third area, when specific to the response system, as you've heard the hospital association say, the strain on the workforce and how that trickles down. So you get overcrowded ERs, to capacity, 5 to 6 hour waits, a decrease in staffing because of the staffing challenges, and the potential for the patient transfer times of when an ambulance arrives at the hospital, the ability to transfer them in a timely fashion to get back in service. So there's a potential reduction in the availability of our emergency transportation services because of those challenges. So once again, thank you very much.
Thank you, Chief. Mayor, again, thank you so much for being such a prominent voice serving our most vulnerable populations in our community. You've been a champion, and I like working right beside you in this effort. And overcoming homelessness is complex. I think everybody's well aware of that. This issue is one of the most complex issues to deal with, and this bill just compounds that complexity. There's 6 key factors that people really need to overcome to even start thinking about getting out of homelessness and getting on the right path, and that's overcoming mental health issues, physical health, substance use, workforce, housing, and poverty. And one of the resources that help us overcome that and work with people to overcome that is Medicaid. And now we're making that more complex and more convoluted, which is going to exacerbate the issue. Getting someone out of homelessness and on the right path is challenging, but the other part that doesn't get talked about near enough is the people that will be entering homelessness because of this. A lot of people divert experiencing homelessness just because they receive the right mental health services and substance abuse services. And as we make that more complex and challenging for people, we're going to see that exponentially increase. And our homeless service providers in our community have been asked for years to do more with less, and this is just making that even worse. But I'm looking forward to working with our mayor and our teams to try to overcome this the best we can, but it is an issue that definitely is going to impact homelessness and those that are on the cusp of becoming homelessness.
Wonderful. Well, thank you to our great panelists for the really important updates. You can see if you use the healthcare system, this will impact you. If you want to see solutions to homelessness, this will make it more difficult. If we want to have a strong fire service, this is an impediment. So Medicaid's been deeply impactful for us at the city. That's on top of what we think may be significant financial impacts from the tax measures, which may hit the city at about a $50 million level when fully implemented. We're working very hard to be smart about these policies, to make sure our community understands them and to do our best to manage them as well as to find solutions. I'll now turn it to Senator Kelly for his reaction and to ask the panelists our first question.
I would say the nationwide impact, the numbers are pretty staggering, but just here in Arizona, just the reductions in money into the healthcare system to support tens and if not hundreds of thousands of people is devastating to think that we're going to wind up with 200 to 350,000 people losing healthcare coverage. It's incredibly impactful. As our panelists stated, the impacts, and as the mayor just stated, the impacts are beyond just people on Medicaid. There isn't a healthcare system that just supports Medicaid patients and another for Medicare patients and another for everybody else. It's the same healthcare system. And the foundation of our healthcare system here in Arizona is Medicaid. So I think that should be clear to everybody. And then the impact it's just going to have on our economy and job loss could be devastating as well. So I guess the first question to the panelists from me is, what do Medicaid recipients need to know right now about these changes? And what do they need to do right now if there are some steps that they need to take? So I'll just leave it open for anybody who wants to jump in.
Any of us can speak to that.
Well, I think Beth has stated it really well, that right now, the most important thing is people need health insurance, and we want them to have health care coverage. It is available. These are future changes that we are advocating to hopefully revert or change or mitigate the damages, but please do continue to enroll and access. Go to coveraz.org. Reach out to any of our organizations to make sure we can help you navigate to maintain, or if you aren't on, to get the coverage you need. So I guess this was our big takeaways. We want to educate about the realities and what could potentially come, but at the same time, we don't want to deter anyone from seeking coverage or getting the care they need.
So how important is it that somebody's information in the system is up to date?
Incredibly important. I think, and Beth is going to know better than me, but the documentation is just critical. Well, in everything we do in this line of work, it's a lot of documentation and make sure it's well done. But as you're already struggling and to get by on a day-to-day basis, I think some of these obstacles will just make it harder for people to provide that documentation, which is critical to maintain and retain health insurance. But the takeaway I would give is please do seek coverage. Make sure you can get through access, through the marketplace exchanges, and please do seek health care when you need it, but work with us to find ways to keep having these discussions, hopefully with other folks who may have heard more about maybe the impact of these bills after taking certain votes, so we can hopefully revert some of the changes, but also make sure we don't make any more.
And as the changes are implemented, two big things here is every 6 months, people are going to have to re-register instead of, what is it now,
Annually,
so it'll go to every 6 months. But the work requirement, that documentation is going to have to be done monthly.
I think that.
Senator, so that's a great question. I think that given the way the law is structured, we all hope, and the agency is still looking at this, that there is a path to just comply with what the federal law said and have that also be every 6 months or annually. And they are looking at their ability to do that right now. And I will say that the state tries to make it really easy for people, as easy as any kind of government program documentation could be, through an online portal, healthyarizona.gov, so people can upload and provide that documentation. I don't want to say it's easy, but the state tries to make it easy, and they are going to look at opportunities, my understanding is right now, for every opportunity to verify things electronically and to make it as clear to members as they can what they have to do and when.
Can I add something
Yes.
to both what Brittany and Beth said? One of the observations that I've had is here in Arizona, we've done such a good job of helping people not know that they're on Medicaid. They look at their health insurance card and they see United or they see Arizona Complete Health. They don't understand that they are in fact on Medicaid. So if I could encourage people to help folks, just we'll look at your insurance card and let's make sure we understand that we're on Medicaid so that this paperwork and all of these new compliance issues will be taken care of because they'll realize it actually is impacting them.
So and maybe nobody here knows the answer to that, when we set up the program in the 1980s, wouldn't it have been better at the time for people to understand that they were on Medicaid? Maybe we gave it the wrong name?
Hindsight's 2020.
I know it was 40 years ago, and none of you people were in the workforce, except for maybe me. But yeah, maybe that was a little short-sighted when we considered the future administrations and how changes could be implemented.
And Senator Kelly, to that point, when we all joined together as a coalition to advocate about these, what then were proposed changes and cuts, that is something we saw firsthand, not only in our polling, but in the responses to some of the advocacy efforts, is to Helena's point, is people didn't even realize, like, well, I'm on access, I'm not on Medicaid. And it made so education is critical moving forward.
Can I just add to, I think what people need to know is that there are resources and people can go to Health Arizona directly, but this can be a very overwhelming process in an environment where there's a lot of fear and uncertainty right now. So getting that support either through Cover Arizona, where you can be connected to someone who knows the process, can help explain what is necessary, collect the documents and submit them. That really helps people get through that process where it's difficult on your own sometimes. Health centers are doing in-reach and outreach in their communities. We are hoping to work again with our department, or with our access office and the health plans. It's worked in the past, and if we get the information that is helpful to health centers about people that will be falling off the rolls, they can do there are more directed efforts that they can make toward helping people stay enrolled.
Got a couple questions for Ray. So Ray, like what percentage of your budget, if you know, comes from reimbursement for transportation to the hospital from EMS services?
I don't know the exact number. Like I said, it's regulated by the state, so our transportation rates, whether it's a paramedic transport or basic transport, and there's mileage on there. So those rates are set by the state. A rough estimate is probably about 60 million. We did about 104,000 transports last year. We're going to trend in probably about 105 to 110 this year. So we are seeing an increase in activity levels and transportation rates. And when I say ambulance billing in revenue, I look at it more as a cost recovery, right? For the high level of service that the Phoenix Fire Department provides in their transportation services, that it pays to provide for those services.
So let's say that 60 million winds up turning into a reimbursement of just 50 million because of these number of people will now be uninsured rather than you being reimbursed from Medicaid. How do you make up that shortfall when you go to the mayor and say, Mayor, I need another $10 million? Does the mayor just write the check?
I think the mayor's very supportive. Public safety is a number one priority. All right. But that is, as we look at the revenue and we try and forecast the projections, we want to maintain those service levels. So that is definitely a conversation with the fire chief and city leadership of how we maintain those level of services.
So do you think you're going to have to, you will struggle to provide the type of service you have today if you have less resources?
Yeah, and I'll say with a fast and growing community, we are trying to keep up with the growth. We have a strategic plan. So this is one of those variables with increased call activity levels, increased transportations is a variable that's not factored in kind of our strategic plan. So definitely as we see the increases, we will need more resources and have to forecast that out.
And then Scott, do you have any personal examples from clients that have struggled to stay enrolled in Medicaid despite being eligible for it because of their homelessness?
Yeah, thank you for that question, Senator. It's an ongoing struggle. Having someone maintain their benefits is even annually having to come up with whatever support documentation for that enrollment or for their SMI determinations. Now this making it twice a year, and we have no idea what documentation people are going to need for their exemptions. But we have example after example of the complexity of making sure someone maintains their Medicaid services now without all these complexities being added to it.
Because being homeless is an exemption, right?
It is.
It is an exemption.
And it's, to some degree, you can read between the lines on certain things that it could get to. That's why.
It was not on the list.
And always correct me if I'm wrong, because I'm wrong often, but I think it's not an explicit exemption, but many people experiencing homelessness will likely have some complex medical conditions that could slot them into an exemption.
Or be a disabled veteran.
Correct.
Or under the age of 19, or
Correct.
maybe over the age of 65,
Correct.
those other exemptions.
Right.
But it'll be work to prove
Right.
that they slot into one
Instead
of
of the
those
case managers
exemptions.
focusing on workforce readiness, housing, mainstream things, now they're going to turn into advocates for Medicaid and supported documentation for their mental health reasoning or substance use reasoning or physical health, or usually a combination of all three.
And I imagine you're going to have to do things you currently don't do now to help people stay enrolled.
We barely have enough funding to do the services we provide now, and that funding's always annually trying to predict what it's going to be. But yes, this is going to make our services more complex and more expensive.
And Brittany, for the hospitals that you represent, have you heard any from your CEOs of those hospitals? Have they given you any examples of things that they might have to do? I'll give you one example I heard from a rural hospital. The CEO said probably one of the first steps they will take because of these cuts is to close the OBGYN clinic. No more births, no more NICU, no more services for women's health care would be the first step. Have you heard of others? Have they given you any examples of actions that they could take because of this legislation?
Oh, Senator Kelly, Mayor, of course, this is the top priority, honestly, of our CEOs and our health systems, and we're still trying to understand the impacts of the bill. Again, advocating hopefully to reverse some of those impacts, but it will cause financial strain and difficult decisions will have to be made. And one of those things is going to be looking at where are you losing money? And labor and delivery is one of those areas that cost hospital and health systems a lot of money, and why we already have a desert, literally in Arizona, but we have deserts across the state that already are struggling with that. They'll also have to find ways to look at ways to maximize revenue in other areas, including maximizing our relationships with the commercial payers. So they're going to have to be looking at all of the ways to make sure they remain in the black and that they keep their doors open and access to care, and including those access points that, we've spent last 15 years doing a great job of getting more people health insurance coverage, getting more care out to the people where they need it. So not always just on our hospital campus, but out on these centers and facilities closer to where the patients actually need it. And you have to look at the possibilities of maintaining all those individual facilities closer to where the people actually reside. And to Helena's point, might force a lot more of that into the more urban areas and putting strain on the urban systems.
Do you know if the hospitals or hospital systems are already communicating this information to their patients, specifically the patients that are on Medicaid, and telling them, like maybe giving them a piece of paper and say, hey, we need to make you aware that you may lose your coverage or you're going to have to take these steps to keep it?
And Senator Kelly, that's something the hospital and the coalition we've all formed, we've talked about that. That's one of the biggest struggles right now, is what are we going to tell the general public? But we don't want to deter them from seeking coverage or seeking care. So it's a tricky dynamic. I do think, to Lisa's point too, I think we're going to have to, as hospital health systems, do everything we can as well to help people navigate the system to maintain their health care coverage. And it may take more of our talent and more effort spent in maybe hiring people or supporting other organizations to make sure we are educating the general public.
And on the issue with premiums going up on the exchange, upwards of 26%, has that started to happen already? I've seen some anecdotal evidence where people have already started to receive notifications that their premiums are going up significantly.
I don't know who this is. It's a big question. Yes, and unfortunately, I don't know. I think that, and I work primarily in the Medicaid space, but a lot of our health plans have sister plans, and I know they're planning for that. I just don't know off the top of my head whether they've sent out notification just yet. But there's also a lot of media swirling, and I think the public is consuming piecemeal some of that. And so to your question about communicating with members, either on the exchange or Medicaid, I think a lot of work needs to still be done to define exactly what the impacts will be on the members. And some of that is going to come down from the federal government in the form of requirements and guidance over the next few months, I hope, so we can get ahead of that and the state knows what they'll need to do and what flexibility they have to implement. And so we then can all take that information and help communicate it out as soon as we can to people so they know.
And then Beth, I have another question on exemptions, and I don't want to, Mayor, if you have other questions, I'll pause after this one, but is somebody in a nursing home, by definition, have special medical needs? Because that's not on the list of exemptions, I noticed.
Yeah, Senator Kelly, they should, because number one, they are probably either over the age to which some of this applies to or have a documented functional disability. In addition, there are some short-term, if they are residing in a nursing facility, pathways for exemptions. So I'm loath to, as you can tell by all of my answers, to commit definitively, but there should be a way that this should not apply, some of those changes, to people residing in nursing facilities.
I think I'm going to do one final question, and we will likely have time for maybe one or two questions from the audience. We have a who's who in the audience, including many of our partners at the city who help with a variety of different services, including navigating our vulnerable populations to be able to get into Medicaid. Could we just talk a little bit about the broader impact on the business community? And
Sure. From a business perspective, we all work for somebody. In fact, we're getting, at the Hospital Association, we're in the process of looking at our health insurance for our employees next year. And, it's very clear that health insurance premiums are going to go up. There's been a lot of news about sort of the historical increases in premiums that employers are going to be facing. I would not be surprised if what we see here, if we can't roll any of this back, those increases to businesses trying to get insurance for their companies is going to go higher and higher. And then it becomes an affordability question. Like, how do you keep doing that?
right, and we don't want premiums to go up because people are waiting till they're sicker to get care. Everyone loses in that situation. So we see that impact on the business. Ray did a great illustration. What if happens to the fire service if we get more calls from sicker people and have lower reimbursement? We want to help people get the lowest cost health care early on before their conditions get more difficult. All right, I do believe we have a microphone over there to open it up to the audience. If you have questions or comments, we really have incredible expertise in here, but if you could please introduce yourself and perhaps stand at a little bit of an angle so both the cameras and the panels can see you.
It's hard to get that first person.
Thank you.
Hi, I'm Adriana. Is this working? Can you hear me okay?
Yeah.
Okay. I'm Adriana Navarro from AZCIR. And Senator Kelly, I was wondering, Arizona stands to lose hundreds of thousands of Medicaid enrollees under this bill, including many who rely on community health centers. What are you doing at the federal level to protect these essential providers, and how are you working with state leaders to ensure CHCs remain viable sources of care, especially in rural and underserved communities?
Well, community health centers, qualified community health centers, are so critical for delivering health care, and it's not just folks on Medicaid. I mean, my granddaughter goes to a community health center for her health care and has a great pediatrician there. We are going to, when I say we, I mean Democrats in the United States Senate and the House are going to continue to fight for these programs and fight to restore much of this funding. But as you know, this doesn't happen overnight. This is Washington, D.C. we're talking about. And progress in the right direction is hard, and this is going to be a challenge. This administration is going to be here for another, 3.5 years, and this was the president's plan, to do this. So it's going to be hard to turn some of this around. But there are programs, I'm trying to remember the number, like the prescription program, 340B is a critical part of how community health centers are funded, and I'm going to continue to fight to make sure that program stays in place so they don't lose additional funding. And I've traveled around to some of these rural community health centers and just to hear from their patients about the impact that this could have. But we're going to continue to fight to restore these programs because it's not making our country more healthy.
Could you expand upon what fighting looks like?
Well, as every year we have battle over the budget and how we fund certain programs. That's largely done in the Help Committee in the Senate. I'm not a member of that committee, and also on the Appropriations Committee. But even on the Armed Services Committee, funding health care for service members is something that we are involved in, and myself and my colleagues are trying to make care more accessible for members on active duty. As an example, we've got 7 major military installations here. We were just able to provide some coverage through the defense bill. It's going to be in this year's defense bill for things like IVF for active duty service members and families. So we're fighting. This isn't, just going to be this year or next year. It's going to take a while. I mean, these cuts that this administration made are going to be implemented. It's just not a matter of like just a change after the next election. This is going to take a while to fix. But I want folks to know that they're folks that are on Medicaid and just folks in general in our healthcare system that are going to be impacted, which is really everybody. Myself and others are fighting in Washington, D.C. to try to fix this.
Thank you.
And we will have some time for media questions after the panel, but if there's anyone from the advocacy, healthcare, or business communities here who had one comment before we close. All right, well, thank you. Can we get a round of applause for our incredible panel? I am so thankful to all the partners who help us have a healthier Arizona. We are going to continue to work to make sure we help people understand their healthcare benefits, the Medicaid system, and navigate it. This panel was just a small taste of the impacts. Medicaid is very important to our education system as well, and we didn't have time to get into that. We at the City of Phoenix have been trying to improve healthcare. That's why we've been investing in university partnerships, training programs, and more, and we're going to keep trying to improve healthcare, but we do have some real challenges ahead. I'm thankful that Senator Kelly has been there leading the way and has been such a great partner in just understanding how deeply that impacts us at the city, the business community, nonprofit, and more. So, Senator, thank you for your leadership.
Well, thank you, Mayor. Appreciate you pulling this together.
Wonderful. Well, thank you all for the gift of your time. You are all such leaders in our community, and the panelists will be available for individual interviews with media. Thanks.